Okay, so yeah, I'm gonna sort of talk about, well, this theme is about housing, so I'm going to talk about the sort of severe end of a lack of housing, which is about homelessness. And I'm going to be talking about, um, firstly, give an overview of the ADR briefly, then talk about homelessness, how it's defined and the scale of it in Wales. Then I'm going to go through two projects that we've conducted in Sale related to homelessness. And as the slide here sort of illustrates, it's about the impacts of homelessness and our responses to it. And then I'll just sum up with some of the sort of challenges and opportunities of using linked admin data to look at homelessness. So to start off with, so I work at Administrative Data Research Wales. We're part of the Administrative Data Research UK partnership, which is funded by the ESRC. The purpose of this partnership is to make better use of routinely collected administrative data. Each of the devolved nations has its own research centre, and obviously I work at the Welsh one, and I head up a stream of work within the ADR Wales related to housing and homelessness, and I do this with Peter Mackey. And although it's housing and homelessness, in actuality, the majority of our work focuses on homelessness, and our work programme is roughly aligned to Welsh Government's high-level action plan to end homelessness in Wales, or to be more exact, to achieve a Wales where homelessness is rare, brief and unrepeated. Now, whenever I say that I work in the area of homelessness, I always engage in a conversation that sort of the assumption of the person I'm speaking to is always that more often than not, that this is what homelessness is. It's people sleeping on the streets. And so I have conversations about, how do you find these people? How do you link their data? That kind of thing. Because this is the assumption. However, homelessness is more than just people without accommodation. Although those people are the more visible element, they're actually the smallest element of the homelessness spectrum. There's also people living in temporary accommodation, but also people in inadequate accommodation. So that might include hostels, homeless shelters, refuges, bed and breakfasts, but also people who are squatting, and then people who are living temporarily with others. And I've included a link to a paper that discusses homelessness, defines homelessness more broadly. So in order to get an overview of the scale of homelessness in Wales, I've just pulled together some statistics. There is no one authoritative source, so forgive the sort of patchwork of references here. But so on the 31st of May, there were an estimated 157 people sleeping rough in Wales, and this is a monthly count, and so it sort of hovers around this 130 to 150 mark. Then in terms of people living in temporary or crisis accommodation, then on this particular day, there was roughly 11,500 people. And this kind of accommodation is hostels and shelters and private rented accommodation that isn't permanent. It's just a temporary accommodation given to the person by the council. And then on a completely different scale, the last figure is people who approach the local authority housing teams and are assessed as homeless. So of these people, of these households, there are roughly 12,500 in Wales in one given year. And I think the figure is 20, 22, 23. So the numbers are quite appreciable. There's, the numbers of people experiencing these different kinds of homelessness are quite big, particularly at the sort of living in insecure and temporary accommodations. But in terms of a population of 3.3 million, homelessness is rare. Homelessness is also dynamic, so people enter into and then exit, potentially only for one sort of episode of homelessness, and then they're never homeless again. And then there's also the issue that obviously when you're experiencing homelessness, you'll probably have fairly insecure housing and maybe moving around a lot. And so these things kind of, from a quantitative research perspective, they're not good if you're trying to conduct a sort of sample survey. And so this is why administrative data are really useful within the sort of field of researching homelessness and other sort of ephemeral phenomena. But administrative data aren't, perfect, as I'm sure we'll all agree. So in the next few slides, I'm going to go through two projects conducted in Sale that used administrative data and its linkage to kind of give an overview of how we did it, some of the challenges, what the outcomes were, and what the policy implications are of those particular analyses. So the first study, I looked at, as the slide says, attendance amongst pupils living in families who were homeless. And the reason for this was, dramatic pause. So we were generally interested in looking at school disengagement as indicators of homelessness. So as the slide says, we were interested in attendance as a signal of the disruptive effects of housing issues. In the UK, the evidence is limited and it focuses mainly on children who are themselves homeless. So the distinction here is they've left their families of origin and are homeless, whereas I was interested in children who are still with their families and it is the family that is homeless. So there's hardly any research related to that group within the UK. There is stuff from the United States, but the United States has a very sort of different approach to homelessness. There's lots of placing people in shelters, which is kind of not where we try and go in terms of supporting people in Wales and the UK. So they're very different kinds of populations. So you can't really transfer the data over from the United States to Wales/the UK. So this is how we went about constructing the linked data set. So we actually had access to data from a single local authority housing team in Wales. Unfortunately, it only related to the main applicant that was always an adult, because children were actually dealt with by a different part of the department whose data we didn't have. So this is obviously problematic because we only knew the adults. So we had to use two other data sets to infer the children who are living with these adults when the homelessness application was made. So that's the Welsh Demographic Service and the National Community Child Health Database. So that allowed us to look at people who were living with the adult applicant, but also make links between the mothers and the children via the NCCHD dataset. So that allowed us to create a population of pupils who are living in households accessing the housing service. I created a population spine by combining two data sets. So this was the Welsh Demographic Service, which is the sort of registrations of where people are living, and the pupil level annual school census, because I wanted to create a population spine of people who were attending schools within this particular region and who hadn't left the region, because otherwise they wouldn't appear in the Swansea housing team data. And then my outcomes of interest were obviously absenteeism data, which is a different data set within the larger education data sets available in Sale. And the dependent outcome that I was interested in was total unauthorized and authorized half-day sessions absent. The other thing about this analysis was it was longitudinal. Unfortunately, I could only combine data for 4 academic years just because of limitations within the Swansea housing team data. But it enabled us to do panel regression analyses. And these are the findings. So in general, within any given academic year, within this particular authority, there were roughly 2% of pupils within schools were living in families experiencing homelessness. So that's about 500 pupils per academic year. Again, in general, if a pupil was in a family experiencing homelessness, their absences were higher. So total absences were on average 5 days greater than pupils who were in securely housed, i.e. who weren't accessing the housing service. From the regression analysis, even after we adjust for things like age, gender, area deprivation, free school meal status, type of school, a load of other things, there is still a difference between housed and family homeless pupils across all types of absences. And then because the data were longitudinal, we could actually look at what's the impact of a family becoming homeless on a single person's absences. And again, after adjustment, there is still an impact on the rate of absence from becoming family homeless. So the discussion, the sort of implications of this, we sort of in the paper, the link to which I provided in the slides, we sort of suggest that there needs to be greater cross-sector working between schools and housing teams. So at the moment, there's a lot of focus on children who are homeless. If a child is still in their family and the family is homeless, then there's far fewer things that happen. Whereas if a child becomes homeless, then social services kicks in and it's a whole, official thing. So the suggestion was there needed to be more for children in families who are homeless to sort of alleviate the impacts of that homelessness. And then tangentially, I'd also suggest that there needs to be a rethink of the logic of fixed penalty notices for absenteeism. So giving a family who are already struggling financially a fine probably isn't the best thing. There were issues with the analysis, so there were mismatches. Like I say here, 75%. So the match rate for the housing team data, it was 75%, meaning 25% of the records couldn't be attributed to a unique person. And then there's also, because children who are homeless were being assisted by a separate department, then we were unable to account for that element of youth homelessness. But that's only roughly 20 people per year within the study area. The next analysis takes a different approach. So we were interested in looking at, rather than the impacts of homelessness, the sort of impacts of stuff that we do for homeless people in order to help them. So during the COVID-19 pandemic, people experiencing homelessness were prioritized for vaccination, but there was no monitoring of that prioritization. And so we wanted to generate evidence to see what the vaccine uptake was like. At the time, the majority of the evidence was not from the UK, but it did suggest that in general, if the analysis actually compared to a general population group, people experiencing homelessness had a roughly 20% lower uptake of the COVID-19 vaccine. Unfortunately, in this case, the housing team data clearly wasn't sufficient because it only went up to 2017. So we had to use healthcare data to identify people experiencing homelessness. And I'll go into slightly more detail about the codes used in the next slide. But we used these three data sets on the left-hand side to create a cohort of people who experienced homelessness just prior to the vaccine program. We then created a population spine or a general housed population group using the Welsh Demographic Service of people who are continuously resident in Wales, but who had not been diagnosed, well, yeah, who had not been flagged as homeless in those health data. So those are our two cohorts, and then we followed these cohorts over the vaccination program up until 30th of November, I think. So that, that's 350 days of the vaccine program we followed them up for. And our main outcomes were receipt of first vaccination or death. So a bit more about how we identified homelessness using these data sets. So the way that you identify them differs. So in the in the hospital data, there's an ICD-10 code for homelessness and these various issues. We also use the substance misuse data set, which actually explicitly asks people if they have accommodation need, which actually refers to use of hostels and shelters. And then the GP data has an array of codes. Some of them are non-specific, so homeless. Some of them are actually quite offensive. So I think there is a code for vagabond in there, which I think is a holdover from the Vagrancy Act. But so using these multiple sources, we were able to cobble together a cohort of people experiencing homelessness. And these are the outcomes. So roughly, it took longer to vaccinate people. People experiencing homelessness. The vaccine prioritization roughly occurred on the 100th day, and after that point, there's no discernible uptick in vaccination rates that's sustained for a very long period of time, as shown by the cumulative incidence of the vaccine over time. And at the end of the 350-day observation period, there was this 20% difference between the two groups, which is in line with international evidence on vaccine inequality. So in the paper, we surmised that a lack of funding limited the effectiveness of prioritization. So this compares to the initial approach to rehousing people during the first sort of initial stages of the COVID pandemic, where local authorities were given substantial amounts of money to rehouse people. That kind of wasn't made available to the sort of third sector in order to sort of promote the vaccination. And so that may have limited its the ability to reach those people. There are study limitations. So obviously the kind of definition of homelessness is maybe at the more extreme end. And there were also some mismatches from the COVID vaccine data, which may account for vaccines given in dicey situations where personal data were actually obtainable, which maybe are homeless people. So just to sum up, with the challenges and then end on the opportunities, because that's nice and positive. So access to homelessness specific data currently limited in sale. We are trying to acquire more data, but it's very resource intensive and is therefore posing a challenge. If we're using other data, other routine data to identify homeless populations, there's generally a lack of consistency in the definition of homelessness. Some of them are vague, so the ICD-10 codes, some of them are very specific, like the substance misuse dataset, which actually provides clinicians with examples of what we actually mean when we say homeless, and is this person that thing? There's also the issue that obviously this is admin data, so the people have to be accessing the services, and they may differ from people who are not. There's also the challenge of defining an adequate comparison group. So, housing data is fairly limited, so we don't know if we, can't construct a sort of adequate at-risk of homelessness group. And so we have to sort of lump everyone who isn't homeless into the one group, which may include a huge variety of housing situations. So there's probably some work that needs to be doing around creating a better comparison group. And then obviously linkage mechanisms are designed for stationary people. So they use GP registrations. And I think there is some research out there to show that, people experiencing homelessness tend to access emergency services more than GPs. So that's problematic. The opportunities, like I said, homelessness is a dynamic phenomena, and routine data provide one insight into that dynamic state, which might be difficult or expensive to achieve through surveys. Obviously, it's population level, so you can sometimes work down into subgroups, which is what I did with the family homelessness stuff. I focused on family homelessness rather than the larger group of people who are approaching local authority housing services. We can link data over time that allows longitudinal and causal analysis, which breaks away from the use of surveys to look at cross-sectional sort of aspects of homelessness. More importantly, we can look at into evaluation of interventions using SAIL data. And then finally, sort of being able to link to other policy areas provides evidence, more evidence, if it were needed, that homelessness isn't just an issue of housing, but there needs to be greater joined up work. And that's it.